Good morning.
Good morning.
How are you, madam?
Fine, thank you.
For the person who is watching you for the first time, Madam Amina, who is she and what does she do?
Okay, my names are Amina Awad, as you have said. I'm the Sub-County Reproductive Health Coordinator at Changamwe and Jomvu Sub-County.
Right.
Our offices are stationed here at Portrees Sub-County Hospitals.
So when we are talking about cancer, being a month at which we mark a lot about breast cancer in itself, does it resonate, or rather is it in line with reproductive health?
Yes, breast cancer and cervical cancer are both in line with reproductive health. They are all cancers which are affecting women. Breast is affecting both men and women, but cervical cancer is a cancer which affects women only,
Right.
because they are the ones who are having that organ.
And where are we in terms of battling cervical cancer?
First, at the moment, cervical cancer and breast cancer are the leading cancers of reproductive health among women in Kenya and globally. In Kenya, we are losing 9 women every day from cervical cancer. Every woman succumbs to cervical cancer every day. It is a cancer which
That's according to the statistics on your table?
That is according to the statistics, yeah. The last survey which was done. So a lot of women are having cervical cancer without them knowing. Unfortunately, it is a cancer which we can prevent. So if the women do the routine screening, we have a lot of chances of preventing them from succumbing to cervical cancer. So there are a lot of women out there who are infected, but they're not having any symptoms. That is the most unfortunate thing. One can have cancer and have no symptoms at all in the initial stages. When the symptoms do appear, it is usually in the advanced stages.
Right.
So a lot of women are affected by cervical cancer and even breast cancer.
Very true. We'll be getting to the symptoms and looking into the fact that you've mentioned. You can be having the cervical cancer, but you do not know yourself until it gets to an advanced stage. You'll be giving us also some of those stages and how can we as a people and our women out there look into how they can get along with dealing with this cervical cancer. But how serious is cervical cancer? Is it that serious, amongst the cancers that we know?
Among the women, it is the second one which is leading with deaths arising from cancer. Reproductive health, cervical cancer is the one which is second, leading in the number of deaths.
Which one is the first?
Breast
cancer.
And it is very serious because once a woman gets cervical cancer, a lot of things do change. When their lives change, they cannot be sexually active as they were before. Their productivity in life changes because now they have to concentrate on curing themselves from the cervical cancer. And when one is diagnosed in the advanced stages, even the treatment, it is time consuming, it is costly, it affects their life generally.
Right, very true. But the biggest question, madam, if at all we know cervical cancer is something that it's quite of essence to look into, and the government knows this stuff, why should it be expensive? Let's begin from there.
It is only an expensive affair when it reaches the advanced stages, because one has to go through the different forms of treatment, the chemotherapy or the radiotherapy or the surgery. But it can be very cheap. In fact, it is free if you take care of it in the initial stages. It is free in the sense that if the women do the routine screenings in our public facilities, they are not being charged anything for the routine screening of the cervical cancer. And those who are found in the initial stages, even the treatment is free in our public facilities. So it is preventable and it can be dealt with in the initial stages in very simple and affordable ways.
Very true. Somebody may be wondering, where do we get this cervical cancer from? Where does it come from?
Okay. Cervical cancer, a woman can get it through the infection of human papillomavirus, which is being transmitted sexually. And there are also a lot of other factors which can contribute to a woman to get the cervical cancer. For example, those women who start their menstrual periods at an early stage in life, and those women who experience their menopause late after the expected time. Those women who have sexual multiple partners, because when they have sexual multiple partners, they have more chances of being infected with the HPV. The women who are multiparous, who give birth to a lot of children, are also predisposed to that.
How is it so? How does it even resonate between giving birth to so many kids and cervical cancer?
The more this woman is sexually active, the more chances are that they are going to be infected with the HPV infection. And how do I put it? As they age, as the women age, their chances of getting the HPV infection also increases. By the age of 50 years, a woman's chances of getting HPV infection is about 86%. So the more they are sexually active, the more they are engaging in sex, the higher the risk of being exposed to the HPV infection.
You know, madam, you're confusing me.
Pardon?
For instance, you're mentioning the more the women engage into sexual activity, they are pre-exposed to HPV. With one partner or different partners? Which one are you trying to say?
I was coming to that. A woman can be engaging in sex with multiple sexual partners. That means she's also being, the risk are also high of her getting the HPV infections because of the multiparity of the sexual partners. A woman can be having with one sexual partner, but that one sexual partner might be having sex with several other women, whom can infect him, and in return he can bring that HPV infection at home to that one sexual partner.
Right. That's how it comes now.
Exactly. So once this woman is infected with the HPV infection, majority of the women are able to clear that virus within 1 or 2 years. Their immunity usually fights the virus within 1 or 2 years. They are able to clear it in their bodies. But there are some who the virus can be in the body and it can stay dominantly in the cervix for several years. It can stay for even 10 to 15 years without causing any problems.
Right.
But then after that, that is when now it's the abnormal cells from the cervix start to grow, which in the end do become the cancer of the cervix.
In a nutshell, if I listen to you so keenly, you're telling me that we the men are the carriers over the HPV that brings on board, or rather brings this all stuff of cervical cancer. Is it so?
Yeah, it is true that can be the case. A man can be having that HPV infection and transmit it to the female sexual partner. It can also be, right now people are engaged in different forms of sex. A woman can get the HPV from a female sexual partner if they are practicing lesbianism.
Right.
The HPV infection, the biggest challenge with it is that one can be infected through skin-to-skin contact, not necessarily through the sexual contact, the normal sexual contact that we are used to. So what this means is that you can have sex with somebody and use a condom and still be able to be infected with HPV if that person has. As long as the fluid of that person touches the skin of the other partner who is not infected, the HPV infection can be transmitted to that other person. So this can happen from men having sex with women, men having sex with men, and women having sex with women.
Right. Right. And looking at the virus in itself, how does it, maybe if it gets into the body, how long does it take for it to kind of get to a stage at which it leads to cancer?
As I had said earlier, some people, immunity is able to clear it within 1 to 2 years, but there are others, it can stay dominant in somebody's body for 10 even to 15 years.
So the immunity can clear the virus on its own? No?
In some people, the immunity can clear it within a year or two. But in others, they are not able to clear it. So the virus can stay in the body dominantly, not causing any harm, for about 10 to even 15 years. Then thereafter now, the changes do start to occur. And within a period of these 10 to 15 years, these women usually do not have any symptoms.
Right.
So they are well, they are running about doing their business as usual. So the only thing which can assist these women is the routine screening. That is why we are encouraging the women of reproductive age group to be going for this screening in all the facilities. In fact, every facility that is offering sexual and reproductive health are in a position to screen the women for cervical cancer. Routinely, it is being done once in 5 years. So it's something which is very doable.
Right. We'll be coming back to the screening. And why do you feel most of our women and the men do not feel that urge to go and do the screening? What is the fear all about here? But before even we get there, if there are men who are watching, you know, we normally hear cervical cancer, we only think of the women. And men tend to ignore this stuff of we being the carriers of the virus that causes cervical cancer. Do we have a role to play in making sure that we also do not get this virus?
Yes, we do have a role to play, and that is the prevention part of it. First, we practice the prevention measures for all sexually or reproductive health transmitted infections. One is abstinence. We are advocating for those who can abstain to abstain. If you cannot, have one faithful sexual partner.
You know, madam, there are youths also watching.
Exactly.
And when you mention about abstinence here, you know it's not easy.
It takes a lot. That is why I'm saying when you cannot abstain, have one faithful sexual partner. Exactly. And then the other preventive measures, we are saying use a condom. However, we've seen with HPV, it is very risky. You can get it even with skin-to-skin infection. So on that note, since cervical cancer is affecting the women only, we are advocating the women, the fathers and the mothers out there to take their young ones for vaccination of the HPV. We have these vaccines in our public facilities and even in private facilities.
Right.
It is free of charge. It is being given to young girls between the age of 10 to 15 years. You
mean I just pick, if at all I have a daughter, I just pick the daughter, take her to the hospital?
Doctor, take to the hospital. There are 2 jabs, 6 months apart. They are being given to children between 10 to 15 years. And it is available. It is very much available in all our facilities. So with that jab, we are preventing these children from getting cervical cancer in future. But they will develop an immunity. So in future, if they come across the HPV infection, their body will be able to fight it back and prevent them from acquiring the infection. That is one way. Right. The other way is for the women of reproductive age group to go for that routine screening. Because as I had said earlier, during the initial phase, there are no symptoms. By the time these women experience the symptoms, they're usually in the advanced stages. So the men out there, let us encourage our women to go for the screening. That is the biggest role the man can play when you are in a sexual relationship with any type of a sexual relationship with your woman. If you care for her, let's encourage those women to go for the screening. It is available and it is free in our public facilities. And those who would wish to go to the private facilities, it is also very affordable because it is a very simple test. It doesn't take much time. A 5-minute procedure or even less.
Right. And I've heard you mentioned about one of the prevention is taking up the HPV vaccine. And somebody would wonder, must we walk into a health center for us to get the HPV? Looking at other vaccines, you guys normally go around giving those kind of vaccines. Have you ever done that?
That is a very good question. Currently, at the moment, in our sub-county, Changamwe and Jomvu, we're having a school program, whereas the sub-county public health nurse, who is in charge of the vaccines logistics, has organized school activities where they are taking those vaccines to the schools. The parents are asked for consent, and those who agree for their children to be given, those vaccines are being taken to schools where all the children are found at one place and they are being vaccinated.
Wow.
it is ongoing as we are speaking.
And in as much as it's ongoing, there have been also concerns being raised about such vaccines. I don't know, you've gotten a few of them. Like that one, people say like you are giving the young girls contraceptives indirectly. Is it so?
Okay, yes, those concerns have always been there. I'm trying to remember a few years back when I started working. Many years back, these rumors, myths and misconceptions, they were already there. And we've had a lot of challenges when it's coming to vaccines. Anything new that comes, usually, we do get such resistance and myths and misconceptions. But I think you can confirm those girls who are given the tetanus, for example, the tetanus vaccines, like 20 years back, are the mothers of the current generation. And at the moment, the teenage pregnancy, it is also, the rate of teenage pregnancy, it is rising. They are the same girls who are being vaccinated with tetanus toxoid, and women were complaining that they are contraceptives and they are not vaccines. What I'm trying to say is these are myths and misconceptions. These vaccines, before they are given, they have usually been approved. They have been researched and approved to be effective and serving the purpose and not any other purpose. Another thing, the HPV vaccine is not something new. It has been there for years in the private sector. People were paying for it. Recently, the government has rolled it out in our public facilities so that the local mwananchi can benefit from it. But as I said earlier, these are the challenges that comes with every new service that comes. I believe it is the same case with the COVID vaccine right now.
Yeah, especially the men don't want that COVID-19 vaccine. Right, but also talking about the concerns being raised, why do you feel, who came about, or rather, where are we not at? What are we not doing right that we give room for such rumors and myths to be propelled out there? Are you not doing your work in terms of educating people about this stuff?
I say everybody is doing their part and is doing their part well, I believe. With any new thing that comes, always challenges must be there. For any new thing that comes, that is, I think that is normal. And those rumors are healthy when people have concerns. It is okay for them to raise them up so that we can clarify them and make them understand. So to me, I say when people have some doubts and have some concerns, it is healthy. The healthy, provided the critics are being addressed and they are positively addressed, and people have concerns, they have doubts because they do not understand, it is very much okay. That is why we are all here, so that we can clarify us with the help of you, the media, and the other department, the concerned department, so that we can make the people understand. And that is even why with the school programs, the uptake has been seen to be good, because now the parents are understanding about the HPV vaccine.
Right. Do you see results?
Of course. As I'm saying, the uptake is good compared to the initial before they understood well about the HPV vaccine.
But earlier on, you had said the numbers keep on rising, and the statistics show that cervical cancer is one of the few cancers that are killing our women.
Exactly, because if you understood me well, I said the HPV vaccination is being given to young girls, and the numbers are rising in the older women, and these are the people who were not vaccinated in their childhood.
Okay.
So with the vaccination program, it is expected by the time these young girls reach the age of maturity, when they are the age of reproductive age, 30 and above, these cases will be decreasing.
Right. I want to take a short break here, madam. When we come back, you've mentioned about our older women being too much exposed with the HPV, and it falls that they fall under the category of being killed by the cervical cancer. How can we help these women? When we come back, we'll be talking about how we can help them. Also, how can we know now I've got cervical cancer, and where do I start from? If at all I've realized I'm been diagnosed to have cervical cancer. All that is what we're coming to discuss up next. Remember, our topic of discussion this morning is quite a candid conversation here. We are having a very sober conversation in terms of making you understand what is cervical cancer. And how do you pronounce it differently from what I'm pronouncing? It is cervical cancer or cervical cancer? Depends with your teacher.
It depends with your teacher.
I guess mine is watching. We're coming back with much more, including talking about cervical cancer, signs and symptoms, and how we can get to treat ourselves out from which. As we also get to the break, share your thoughts, share your experiences. I'll be sampling your views as we get along. Don't go too far. Before we even get to another subtopic on cervical cancer, it says, can I get kids after being diagnosed with cervical cancer?
It depends at which stage one has been diagnosed with cervical cancer. If somebody has been diagnosed in the early stages and they are able to be treated and return to normalcy, they can do have children after cervical cancer. But for those who are being diagnosed in the late stage, some of them do have to undergo surgery where the cervix is removed or the cervix together with the uterus are removed. In such cases, it's unfortunate one cannot have children. But for those who get screening and they are diagnosed early and they are treated in good time, yes, they can have children after cervical cancer.
Right. Another one says, do I need any other tests before deciding on the treatment, just like the case of HIV tests? Do we have one? You can mute that.
Pardon, come again, please.
Says, will I need, or do I need any other tests before deciding on which treatment to take, just like the case of HIV?
Okay, so what happens is this, when they do the routine screening, usually we check if they are having the pre-cancer lesions. That is the pre-cancer lesions. It is the stage where the cells of the cervix begin to change. They start to become abnormal.
All right.
So when they are being found in that early stage and we see the lesion is small, the abnormality is very small, they do not need any other test. They are treated right away. In fact, it becomes a very simple procedure. The same visit that the woman walks for screening, they get to be treated and they go home after they've already been treated.
Okay.
But for those who are found while the cancer has advanced, they do have to go undergo some other test to see the extent of the cervix, which will determine now the cause of treatment.
Very true. Right. And if I get the thoughts of the individual who sent this message here, his worry is, in the case of HIV, you can, before even you get to meet your partner, you can choose to go walk into a VCT, get tested to know your status. Is that the case? We can do the same with cervical cancer?
With cervical cancer, there is this test we call for HPV, which we say the HPV is the virus which causes the cervical cancer. Yes, one can go to a health facility and be tested. But we have it in our public facilities here at Portree Sub-County Hospital. It is there, it is being done free of charge. So we encourage the women of reproductive age group to go for the test.
All right.
So that they can know their status.
And talking about the HPV, we the men, you've mentioned that we do also carry the HPV virus. Does it in any way affect us, or we are just carriers?
Most of the men are just carriers, but it can also affect them. A man can get cancer of the penis through the HPV. There are those men who are having sex with men, they can have cancer of the anus as a result of the HPV infection.
Right.
There are those who practice oral sex. You can get the cancer of the back of the throat as a result of the HPV infection. So yes, the men can be affected with HPV.
Right. we are clear in the air and calling a spade, not a big spoon. Good. Now, when we get back to the different stages you're mentioning here about cervical cancer, at what stage do we begin to see these signs, and which are some?
As I said earlier, unfortunately, when a woman begins to see the signs and symptoms, it is usually in the advanced stage. The initial stages, usually they are asymptomatic. So the only thing which will assist these women to know themselves if they have cervical cancer is through the routine screening. As I said earlier, a woman who is HIV negative, they need that routine screening once in every 5 years. For the ones who are HIV infected, because of the lower immunity, they are supposed to be screened once every year.
Right.
But for the general population, once in every 5 years. The screening is very simple and it is free in all our public facilities. It is also being done in the private facilities which are offering reproductive health, and it is also very affordable even in those private facilities.
Right, but somebody, madam, may worry, like, what can I see that can make me go to be tested? For instance, can I see a lump somewhere? Can I see a ooze somewhere, or what? Okay,
for the HPV infection, usually some do develop warts. If you've heard of the infection warts, it can happen on the vagina, on the penis, on the vulva. The virus which is causing the warts can cause an ascending infection to the cervix.
Right.
So that can be, but there are times you will not see any symptom. You will just have that infection from skin to skin or from sexual intercourse and have the infection. And without having any symptoms, years later you develop cervical cancer.
Very true. Right. And talking about getting to go and do the screening, it's something that most people do not feel comfortable maybe to go and get screening until they get to an advanced stage where they realize that there is need for me to go and get tested for this. Why is it so, madam?
First, I would say as Africans and as Kenyans, we do not have a culture of going for medical checkups routinely. Even right now, right here in this environment, I can say maybe over 80%, even all of us, might not be going for the routine medical checkups, which even we have the resources to do that. NHIF it is in the cover of the NHIF, one medical checkup once a year. But do we utilize it? We don't. So it is not in us as Kenyans to have that routine checkup annually just to see how your well-being is, whether you're having any health issues.
Right.
One that is one. The second thing, as I said, usually these women do not have any symptoms. So if one has no symptoms, they do not feel the need that. They do not feel that need that maybe I need to go and have this checkup. Maybe I might be having a problem. The other thing, the fear of the unknown. People do fear that if I go for the screening, I'll be told I have cervical cancer. But it's better that you are being diagnosed in that early stage, and you can be treated free of charge, or even if you have to pay something, it is very minimal. It is not time consuming than to wait until you're in an advanced stage and have to undergo chemotherapy or radiotherapy or even surgery to have your whole uterus or the cervix being removed as a result of cervical cancer. So you
advocate for cancer screening?
I advocate for the routine cancer screening. And I want to challenge the men out there. You are the people who are having sex with this, how do I put it in a right way?
Right.
You are the caretakers. How do I put it? You are the ones who are in charge of these women.
Right.
So let us encourage our women to go for that routine screening. The mothers and the fathers out there, the parents of these young girls, let us take them for the vaccination of the HPV so that we can prevent future infections of HPV and our young girls from getting HPV infections and having cervical cancer.
Right. 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 And I had earlier on asked you about how we can help our older women. Maybe I've heard you mention that the vaccine is given to the young girls. What about the older women? Should they wait and go for the screening alone? Do we have no tablets, no any sort of vaccine?
For the older women, they have to go for the routine screening. That is the number one preventive measures. They go for the routine screening, and if they are found to be having signs of cancer, they can be treated immediately.
Right. And there was an aspect about culture that is being played out when we are talking about how circumcision is key when we are talking about HPV virus. And we also have communities that do not practice such kind of cultures. Exactly. Is it a concern to you as well?
Exactly. It is even a concern to the government. That is why there is a program of voluntary male circumcision. There is a program on medical voluntary male circumcisions where we are encouraging the men to be circumcised. For those men who are not circumcised, that foreskin harbors a lot of infections, HPV being one of them. The men who are not circumcised, even their chances of having infection is high because of the foreskin.
Right. And how do you get to balance between, not interfering with other people's cultures and making sure that you do your stuff of health?
We sensitize them. We sensitize on the importance of them having circumcised, the dangers. We educate them on the dangers of not being circumcised and the harm it can cause to them, themselves, the men, and the women who are they're engaging in sex with.
Right. Now, for instance, somebody is diagnosed with the cervical cancer, and it's day one. I've gotten the big news that maybe, yeah, it's true, you've got cervical cancer. Where do I begin from?
Okay, in our public facility, not even in our public facilities, in our facilities, for all those who are screened and they are found to be having cervical cancer, they are supported psychologically. They have to undergo counseling to support them to be able to cope with it. First, they are counseled even before the screening. There is a counseling we call pre-screening counseling, where we counsel these clients and give them information on what cervical cancer is before they're even screened.
Right.
What having a positive result means and what having a negative result means, the pros and the cons, and the management that comes after that. So after the testing, if one is being found to be positive, even when they are given their results, they are usually already aware of what will happen next, and most of them usually are composed because there is power in information. If somebody knows that if I'm screened and if I'm found positive and I can be treated immediately and be cured, even if you tell them you're having cervical cancer, at least they have the confidence that there will be life after being diagnosed.
Right, very true. Clear words there from my guest, Madam Amina Awad, who is the current reproductive health coordinator in Changamwe and Jovo sub-county, speaking about the cervical cancer, one of the killer disease amongst the women. And she says here that it's not a dead sentence when we are diagnosed with cervical cancer, right?
Yes.
And also, I read somewhere where they say that cervical cancer is one of the most treatable cancers, especially for the women. How so is that?
Exactly. As I had said earlier, through this screening, if a woman is found to be having that lesion of that cancer, and the lesion is still small, it has not occupied more than 75% of that part, of the affected part, they can be treated there. And then right now, the Ministry of Health, through the national government with our Department of Health, Mombasa County, has rolled out some training from the healthcare workers to the community, health volunteers, to sensitize the healthcare workers, first to gain knowledge and skills on screening. They are also having programs of conducting inreaches and outreaches to enhance the screening of cervical cancer in our facilities. In all our public facilities, the screening has been really enhanced. Right now, the uptake is high because we've put measures in place, different strategies to make sure that we've created awareness on cervical cancer, and the community units are referring clients. Health talks are being given almost every day on cervical cancers in our public facilities to educate the community on cervical cancer, and as a result, we have managed to increase the uptake of cervical cancer currently. So the women are being screened, and through the capacity building of the healthcare workers, they have been trained, they can screen and be able to treat at the same time. So we are having an approach which we call screen and treat of cervical cancer. If a woman is screened and found to be having a lesion, as I've said, which is less than 75%, they are treated there and then. So they are diagnosed and they go home already treated. And as I said earlier, majority of the service providers in our public facilities offering sexual and reproductive health have been trained currently.
Very true. Right. It is said that there is also a need to observe hygiene when handling or rather looking into cervical cancer. How is it so, and how do we go about it?
Okay, so hygiene is very important when it comes to prevention of cervical cancer. As I had said, one can be infected with the HPV through skin-to-skin contact with somebody who has the HPV infection. So on that note, one needs to maintain hygiene in order to prevent themselves from being infected. So immediately after sexual intercourse or on a day-to-day life routines, it is important for women to be cleaning their private parts or their genitals, even the men, to keep them clean. So for those who are having the HPV infection, if they have cleaned themselves and they have freed the skin from the virus, the chances of them infecting or transmitting will be minimal.
Right, very true. Right. This whole information that you're giving me right now, do you feel it's out there? People know whatever we are saying?
As a Department of Health, Mombasa County, right now, we have really tried to enhance these services by creating awareness, sensitizing the communities, giving this information and encouraging them even to go for the routine cervical cancer screening.
Right. So you've made strides in creation of awareness?
As I said earlier, health talks are being given in our health facilities. We are conducting inreaches and outreaches. The neighbor facility here, Magongo Dispensary, just this week on Monday, or at the APZ, they conducted an outreach on the same. They screened both for the breast cancer and the cervix. And prior to that, they created awareness by giving health talks on the same, on preventive measures, on how the women can get this cancer, the factors that are predisposing them to both breast and the cervical cancer. And even here at the facility, they gave free services on the same, where they were giving health educations first to the clients, both men and women, and they screened the breast for both male and women, and they did cervical cancer screening for women.
Right.
Free of charge.
Free of charge.
And the same is being done across all the other public facilities within Mombasa County. The Department of Health Mombasa County is really looking at this indicator for now to make sure that the women are getting screened and those who are being diagnosed so that they can be treated and we can save lives of these women.
Right. Very true. October is one of the few months that we normally discuss matters about breast cancer.
Thank you.
And I can't let you go without commenting on breast cancer as well.
Thank you very much for giving me that opportunity. When you screen a woman for cervical cancer, you cannot leave that breast because she's the one who she has both organs. Breast cancer and cervical cancer are the leading cancers of reproductive health among women globally and even here in Kenya. So we are advocating for these women to come for breast cancer screening. In our facilities, and even in the communities, as I said, we do the outreaches. We do teach them on how to screen themselves for the breast at home once a month.
Is it possible?
Yeah, it's possible. First, before I even talk about this, the screening of the breast, I want to emphasize that as much as cervical cancer cases are high, it is the same case with the breast. We are losing almost the same number of women to breast cancer here in Kenya as in cervical cancer. The same way, in the beginning stages, these women are symptomatic. And for the breast cancer, they can only identify themselves by doing the self-breast examination once a month at home, and then coming for the clinical breast examination in our facilities once every year. We teach the women on how to do a self-breast examinations at home every month, and then we advise them to come for the clinical breast examination, where they come to the facility and they are being screened by either the nurses or the clinicians, or even the medical doctors for the breast cancers. And for breast cancers, they usually start with the women experience as a lump in the breast. The lump might be painful or it might not be painful.
What brings the lump now?
The breast cancer is also associated. There is the exact cause is unclear, but it is associated with many factors. One, those women who do not breastfeed. We have many women who refuse to breastfeed. There are those women who start their menses earlier, the same way as in the cervical cancer, and those who reach menopause much later than they.
Breastfeeding reduces?
Breastfeeding reduces breast cancer.
Okay. Wow.
There are those women, the lifestyles, eating of the processed food, these fast foods, a lot of chemicals, a lot of preservatives, it predisposes them to breast cancer. There are those women who are on hormonal therapy. There are women who, when they reach menopause, they want to delay it, so they go for menopause or for hormonal treatment. There are women who are having health issues, other health issues, which are put on hormonal treatment. Their chances of getting breast cancer are high in those clients. In all those women who are predisposed, most of them do experience the lump, and they can only identify having that lump through those screening. The monthly screening, the monthly self-screening at home, and we advise them as soon as they experience a lump, they come to the hospital. On top of that, they should also go to the health facilities once a year for the clinical breast screening, where they're screened by a professional. For the women who are above 40 years and above, they are advised to go for the mammogram at least once a year, so that they can be identified. At times, a clinical or breast examination or a self-breast examination might miss out on diagnosing the breast cancer, but the mammogram do. Right. Exactly.
And it does not have any sort of age bracket at which you're supposed to start screening yourself for breast cancer?
As for no. Even the young girls can get breast cancer. So we are advocating for women of reproductive age group, all of them from 15 and above, to be to undergo the screening.
But the biggest pipeline there is go for the screening.
Go for the screening. This is a breast cancer awareness month. We have series of activities of screening for breast cancer within Mombasa County. Last weekend it was being done at Mvita Dispensary. Currently, as we are speaking here in Changamwe and Jogo Sub-County, all our public facilities are offering the service free of charge. So I encourage the women and the men, even the men can get breast cancer.
Sure.
Yes. So we encourage everybody to go for the screening in our public facilities. It is free of charge.
Right. Very true. Unfortunately, we are time bad here, but we do appreciate your time, and we do believe that those who have watched us have had time to understand concerning cervical cancer and also in the larger sense breast cancer. But last but not least, to the government, what do you think you can say concerning the fight against cancer in Kenya?
Okay, the government, in terms of screening, the government has really done a lot. Healthcare workers have been capacity built, they've been trained, they have the knowledge and the skills to conduct the screening. The National Cancer Control Program, together with the county government here in Mombasa, Department of Health, with the help of the chief officers, public health and medical services, healthcare workers have been trained. The screening have been enhanced in all the facilities. On top of being conducted in the facilities, the healthcare workers have reached out to the communities where they conduct the outreaches to screen these women. Last month in September, we screened over 1,700 women within the week which we commemorated the World Contraceptive Day. That was through the county government of Mombasa with the assistance of its partners. So in terms of screening, the government has done a lot. And even in management here in Mombasa County, we are having a cancer center at Coast General Hospital. Where they're being managed there. And even here in Portrees, they are able to manage both breast and cervical cancer. They do the surgeries, and for the clients who need the chemo, they're being referred to Coast General.
So generally we are good.
We are heading in the right direction.
Right. I like how we put it.
Yes.
But of course, thank you so much for your time. And like I mentioned, it's a pleasure to have you. And anytime you're welcomed most at Boss TV.
Thank you very much for the opportunity.
Right.